Hello, I am Dr. Namrata Agrawal, a critical care specialist at Borivali Healthcare. Have you ever wondered how a doctor stabilizes a critically ill patient in life-threatening conditions? So here's how. Today we will break it down one by one. So doctors are always trained to look after the patient who arrive in an emergency in a format, and this format goes as A, B, C, D, E. A is for airway, B is for breathing, C is for circulation, D is for disability, E is for exposure. So A goes like airway. So airway is the mouth passage, and the airway passage is open or patent or not. So if there is any injury on the face or on the neck which might compromise the airway, then we have to tackle that first. So patient may require a support for an airway in the form of oxygen mask, endotracheal intubation, sometimes emergency tracheostomy, and ventilator support. Next goes for B, breathing. Breathing, after the airway is stabilized, we go to breathing, and the patient is breathing well, or even after performing endotracheal intubation or giving the oxygen mask. If the patient is not breathing, then we might have to adjust the settings or perform some maneuvers to aid the patient in the breathing. Third is circulation. Circulation in the form of blood pressure, blood in the body. If the patient is bleeding or the blood pressure is low, we insert an IV line and give fluids, or if at all the bleeding is too much, we might have to give blood and blood products as well. We need to stabilize the pulse, blood pressure, and oxygen level of the patient before going forward. So these steps can be done simultaneously, like one doctor is checking the airway, second is checking the breathing, third is taking care of in circulation. It doesn't have to be one by one, it can all go in hand together. Then we also assess the patient for a disability in the form of brain function. How is the brain function? We check the GCS of the patient, pupils of the patient, and take the measures at that time. If we feel the pressure inside the brain is high, or there is a brain injury or brain edema, then the measures needs to be taken immediately. And if we suspect that there is an injury or bleeding inside the brain, then we need to call for a neurological or a neurosurgical consult. And if the patient requires surgery, then it has to be done before going to the next step. So the last step is exposure, which is we expose the body of the patient, we remove all the clothing, all the ornaments, and we see for any injuries, any rashes, any clue that can guide us as to what the disease is. So this protocol goes for trauma as well as the patient who walks in with any disease. So ABCDE is the approach that every doctor follows whenever they see a life-threatening condition. So along with this, sometimes there are some tools that the doctors require to help in all these things. Like I discussed, monitors are required to check the pulse, blood pressure, and oxygen levels. Sometimes an ultrasound might be required to find the clue as to what the disease is or to find out the extent of the trauma. Other than that, some emergency medications might be required, like if the patient has gone into cardiac arrest and we need to perform the CPR, then the crash cart, emergency trolley, or some drugs and defibrillator might also be required to help in treating this critically ill patient. So these are the steps that we follow, and in an emergency every second counts. This is what we call as a golden hour. The patient needs to be stabilized within 1 hour of their arrival in an emergency. After that, once the patient is stabilized or we have performed all the steps of ABCDE, then patient needs to be shifted either to an ICU or for surgery, whatever the patient needs. So the goal of these steps is to stabilize the organ of the body, organ functions or the body before getting to the diagnosis or before treating the disease. So always stabilize the person and then think about what this patient has got. You can think about it simultaneously, but the treatment of it depends upon the initial stabilization. So it is always a teamwork that we do for initial stabilization. A team of doctors, team of nurses, team of paramedical staff, sometimes relatives also helps in stabilizing the patient. So recently we had a young male, somewhere around 25-year-old, who had got 40% burn over his body. He had come in the early morning hours at around 4 a.m. with the relatives, and he was in intense pain. I immediately came to the hospital. We were the team of 3 doctors. There were 4 nurses who were with us, and we stabilized the patient within 1 hour. We stabilized the airway. Patient fortunately Fortunately, he didn't had any airway issues, but he required oxygen. So we started him with the oxygen. We put in an IV line along with that central line also, because the patient was severely dehydrated. So whenever there is burns, there is an intense fluid loss from the body and the patient gets dehydrated. I put ultrasound guided central line immediately in the neck, and through that we had started him on fluids, and around 24 liters of fluid were given in 24 hours through that central line. So this is what the intensity of dehydration that the patient goes through in that burn. Then we did the quick neurological examination. Patient was fine, and we exposed the body and we calculated the percentage of burns. We did a specialized collagen dressing of the patient after cleaning the area thoroughly, and the relatives helped us in the form that patient was a little heavyweight. So patient needed to be shifted from and stretcher to the ICU bed. So the relatives also helped us in that. So this is always a team work, because we were available, the team of doctors and nurses and the relatives were available. We were able to stabilize the patient fast, and the patient got well very quickly. I hope this answers all your queries and you have liked my video. If you find this video interesting, please like this video. Please comment down below if you have any suggestions or any questions or any future video recommendations. Please subscribe to my channel as well to keep watching these interesting videos. Also, I have an Instagram and Facebook page where I make short videos in the form of reels. You can go watch those videos as well. Thank you.